Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Bakht. I'm the internal medicine physician at the Islamabad International Hospital. Today I'm going to share with you a new study about the high blood pressure, that is hypertension, which was published in the Lancet journal. It was found that as we generally think that hypertension is a monolithic risk factor for the cardiovascular diseases, but in this study it was found that hypertension, depending on the type, that is the systolic blood pressure or the diastolic blood pressure, it has different complications depending on the type of hypertension and depending on the age. What they say that systolic hypertension leads to intracerebral hemorrhage, subarachnoid hemorrhage, and diastolic blood pressure, it leads to abdominal aortic aneurysm and its rupture. Similarly, the pulse pressure, which is the difference between systolic blood pressure and diastolic blood pressure, it is related with the peripheral arterial diseases. So what they found that the young population who are suffering from the systolic blood pressure are prone to coronary artery diseases, and the elderly population with systolic blood pressure, in them it leads to heart failure. So what they emphasize on that younger population with mild hypertension should change their lifestyle, and if the blood pressure is not controlled with the lifestyle modification, then they should be put on antihypertensive medication to avoid atherosclerosis and ischemic heart disease later in life. This study was conducted in UK. So what they say, that both systolic blood pressure and diastolic blood pressure have different complications, and both of them should be controlled. There are two types of risk factors which are responsible for the hypertension. One are those risk factors which we cannot change, and they are called the non-modifiable risk factor. They include age, gender, and ethnicity, that is genetics. Those factors which can be changed are called the modifiable risk factors. They include sedentary lifestyle. If somebody doesn't have any activity and the life is sedentary, it can be changed. Moderate to vigorous physical activity. Moderate to vigorous physical activity for 30 to 45 minutes can lower the blood pressure. Second is healthy food. If we take more fats, more salty diet, it should be replaced with a diet with low salt, low fats, and it also can decrease the blood pressure. Similarly, regular physical activity can lead to decrease in the stress level. Stress is independent risk factor for the ischemic heart disease. It increases our sympathetic activity and it increases the blood pressure. So all these factors are the modifiable risk factors, and it is called lifestyle modification. Initially, we put the patients on lifestyle modification for at least 3 months if it is stage 1 hypertension or stage 2 hypertension. But if it is not controlled with the lifestyle modification, then we put the patients on different medications. And we must emphasize that medications are prescribed on individual basis. The patient should check the blood pressure regularly. One thing we notice in patients that they are not compliant with the medications and they don't check their blood pressure regularly. The reason is what they say, they don't have any problem. Hypertension is called a silent killer because in most of the cases the patients don't have headache, they don't have any problem, and suddenly there is a rupture of blood vessel inside the brain. It leads to complication in the form of stroke, it leads to heart attack, it leads to hypertrophy of the heart, and it leads to ischemic heart disease. That's why it is called a silent killer. So medication should be taken on time. The patient must be compliant with the medication. Blood pressure should be checked regularly, and we should modify all those factors which can be modified. So it was a new research which I shared with you initially, that both the systolic and diastolic blood pressures have different complications, and also it has different complications on the basis of age. So neither systolic nor diastolic blood pressure should be underestimated. I hope this video will be beneficial for the physicians and for the community as well. If you like the video, please like it, share it, and subscribe to the channel. I will appear in the next video and will share some new research and updates. Thank you so much. So nice of you. Bye bye.